Morning, Barbados, good morning. Wake up, wake up, wake up. Morning to you.
We're back with you on Morning Barbados. 11 minutes after 6 o'clock. That's our time for this beautiful Tuesday. Dr. Andrew Ford is our dermatologist, and we're getting into the skin right now. Good morning to you.
Hi, good morning, Cassandra and Doug.
Good morning
And
to
everybody
you.
else.
And those of you who are viewing, if you can call us and tell us how to pronounce this word, you'll win a free consultation with Dr. Ford.
If you try spelling it, I think that they'll forget half of it before you end, before you get to the end. of the spelling. You see? Say it again. Go again.
Dermatomyositis.
Close,
You
close.
forgot an O.
Okay.
Yeah. Okay, good morning, Dr. Ford.
Morning, yes.
So how is it said?
Dermatomyositis.
You see?
Dermatomyositis.
I would
yeah.
never
Close, close. Very close.
Okay. Myositis. Dermatomyositis.
Dermatomyositis. All right, now
Yes.
that we've gotten past how to pronounce the word, what is it?
Well, it's an autoimmune condition that isn't very common, and it involves the skin and the muscles as well. So it's another, we've done a few autoimmune conditions like lupus, and we did one called scleroderma or morphea, and this is just another one that I think we all need to know about.
Okay, and well, what does it look like?
What does it look like? Well, initially it starts as a kind of a red or bluish discoloration on sun-exposed areas, but one of the most common signs is what's called a heliotrope, or which resembles a flower, discoloration of the eyelids with swelling.
Puffy eyes.
Yes, your eyes get puffy, your eyelids get puffy, and you get swelling. More difficult to discern in the darker skin, but in the Caucasian skin you see that violaceous change, but in us it looks a little different. Just redness and swelling, but the puffy eyes are the real important thing that you notice. But also it can spread to the cheeks and to the nose and to the center of the face, just like the lupus that we'd seen earlier. So it can affect the central part of the face.
Right.
But they look a little different there in this particular patient on the left.
Yes, this is just to show that it can affect guys, even though it mostly affects women. But this is a more severe case. The whole face is swollen in this case, and also you notice that the hair, you can get sparse hair as well as dryness. And this is a much more severe manifestation of the condition. But it's important to know that if you get a sun-related rash, which would affect the face, the V of the neck, and the upper part of the body, including the arms, that it's a sign that you could be getting dermatomyositis, and then that's followed by eyelid swelling. That's one of the real signs of dermatomyositis. This is just to show you that other parts of the body can be affected, just the areas that are sun exposed. On the left you can see a darker area on that arm, and on the right that's the same person you saw with the whole swollen face. The skin is actually quite red, but you don't notice it there unless you look at right in the lower left corner there. You can see it. But it's interesting to note that the muscular aspect of it can be quite profound because you get muscle weakness. So this is an individual that has difficulty combing their hair, reaching for objects on a shelf. Even getting up from sitting is difficult, walking, that sort of, the muscles become quite weak. And in that second individual with the swollen face, they had great difficulty climbing the stairs and had to be taken around. And also it can happen to children as well. This is a manifestation called Gottron's papules, which are usually these polygonal flat areas on the knuckles or the joints of the finger, and they can have that violaceous look. But again, the darker skin, you don't appreciate it. It just looks like dryness, so it can be misdiagnosed as psoriasis and other similar conditions as well.
Does that go away at all?
Yes, it can. The skin manifestations can go away, but it can be quite a chronic condition that maybe 20% of people, they get complete resolution, but in the others, it's a chronic condition that you have to manage. But the manifestations of the muscles can be quite profound. This just shows the fingertips, where around the nails, you can see some little blood vessels. If you look right around the nail border there, you'll see some reddish discolorations.
Oh,
and
that's not the
that's
nail polish.
No, not I'm not showing the nail polish. That is nail polish, but I'm not
yeah, but I mean, I
focusing
can
on
see.
that.
Yeah, but it looks a lot
Just
like
around the nail
polish.
folds.
Dr. Ford.
Oh, and it's red because it's Christmas, right?
Oh, yeah. I'm just kind of curious. Why would that skin condition affect the joints and the
yeah,
muscles?
That's what I'm
Well,
wondering.
it can affect all the connective tissue and the organs as well. It depends on how profound it is, because it can move from being just a skin condition. It can be a skin and muscle condition. It can also affect children under between 5 and 15. That's a juvenile form, and there is a disseminated form that can affect the lungs, can affect the heart, and also can affect the joints. And you can get changes of the hands, called mechanics hands, where the palm of the hand and the borders of the fingers get very thick. And you can also get calcium under the skin, and that happens to children a lot. Get calcium deposits around the elbow, so it can affect many different areas, but when it's that severe, it can cause death.
When that happens, what is the result?
Well, that's one of the more difficult things to get rid of. That requires some really aggressive therapy or surgery to get rid of calcium deposits on the skin. That can be very difficult.
Well, what causes it to penetrate the dermis?
Well, it's really an inflammation of the blood vessels and the connective tissue. So that's why it can affect all these different areas, including the lungs, what's called the interstitial areas. Autoimmune conditions are usually systemic, but sometimes it can be just confined to the skin if you're fortunate enough for that to happen.
What causes the problem in the first place?
Well, most of these autoimmune conditions have no known cause. Sometimes they think it's your genetics. It has been noticed that some medications can cause it, like hydroxyurea, or sometimes medications called statins that help to take care of your cholesterol. That's very rare, of course. But it may be environmental, it may be your genetics, it may be just that your body just isn't working properly and it starts to attack itself. And that happens in lots of cases and can be quite difficult to control.
Okay, how does it affect people then who want to keep an exercise regime?
Well, certainly if you have the arthritis part, that makes it difficult for you to move around and to be as free with your movements as you would like. Also, because of the sun sensitivity, it means that some people can't exercise outside during the day because they would it would flare up their rash, and the rash can be quite itchy. So sun exposure will make the rash worse, even though you wear sunblock. The sunblock can never be as strong as the sun. The sun always wins when you wear sunblock. So you always have to be aware of what you're able to take.
What would the possibility of misdiagnosing this? Because a lot of people have arthritis, and you call it mechanics hands.
Yeah.
I mean, you know, a lot of people get calcium buildup and so on, and they don't think of these things. And particularly, as you said, in darker people,
It's more difficult.
It is more difficult.
Yeah, well,
to discern.
certainly it's a condition that requires some experience with darker skin if you're going to diagnose it. So there's lots of misdiagnoses, especially in bigger countries where some doctors would not be accustomed to seeing individuals with darker skin. But you really have to understand the progression, the sun exposed skin being affected, and then looking for the eyelid swelling. Usually that is one of the big signs for check Doug there after the
swelling happened.
Is it persistent? Does it persist, the eyelid swelling, or does it come up and
No,
go
it
away?
waxes and wanes. It depends on how good the treatment is, because there's so many. Most people have to go through several different treatment options to find the one that suits them. You may just start some topical things or some oral steroids, or use steroid-sparing drugs, even anti-cancer drugs like methotrexate and some of the others that would reduce it. Or intravenous immunoglobulins. There are lots of different ways you can go about it. And now the newer medications called biologics, they're used as well.
Okay, so they're specific agitators then, because if it's coming and going,
Yes,
it's
certainly.
stress,
Mostly it's sunlight, but the condition does have an agenda and for you, depending on how your immune system is working. So you have to monitor it and treat it as necessary.
If you get rid of the problems, the cosmetic problems, how do you get rid of some of those physical problems that impact you?
Well, sometimes you need surgery and other things, but that brings up a good point that in some individuals, especially individuals over 50 or past 60, you have to look for an internal cancer, because that could be the thing that's triggering it. So finding the cancer is important. Once you're over a certain age, you have to have a total body examination to try to see if there's an underlying cancer, and in which case you have to get rid of that in order to solve the problem.
Okay. All right. Well, thank you, Dr. Ford, for coming in and sharing with us. He had an interesting video. Unfortunately, we couldn't get it to be able to share that with you. But
Another
there's
time.
always another time.
Yeah.
It's the holidays, and we hope you're having a good one. We'll take a short break, and we'll continue in a moment.